Okay, it's 9 p.m. here, so we might as well get started. Um, I was going to present another case of trigeminal neuralgia this week, but this was a case that I had that I didn't get to cover in the first presentation I had in this series of three. So I figured I'd just go back to this one. It's an interesting remedy, and hopefully you'll learn something from it. So let's get started. So again, what I'm going to do is go through this abbreviated case that I have here. It's back from 2017. And then I'll kind of go over the analysis. And I've got some PowerPoint presentation, a couple of slides, about 4 slides, and we'll use the radar to get us in the ballpark with regard to remedies and find the rubrics that represent the symptoms in the case. So as I'm going through this, if you have any questions about symptoms, when I get done with this, I'd like to hear what people think about symptoms that we should repertorize. And then we'll just kind of go from there. All right. So this was a 34-year-old male that I saw back in 2017, September. He presented with rectal itching and pain, severe appetite, weight loss, and dizziness for the last 4 months. So obviously one of the first things we should think of, well, what was happening 4 to 5 months ago, around the time when these symptoms started, right? That should be one of the first things we should think. And we'll get into that, where he was and what happened. So we start with an open-ended question. Tell me what's going on. Tell me how I can help you. Something that's open-ended to invite the patient to start speaking about, well, why they're consulting it. So he says, I've been dealing with these abdominal, rectal symptoms with weight loss and dizziness for about 4 months now. So obviously we want to hear more about them, right? Tell me more about that. Tell me more about that, or specifically what you want to hear more about. It's something that you should get used to saying, because we're trying to get to a degree of specificity and uniqueness in a case that most patients aren't really aware of. And when they say something that we would consider strange or peculiar, our ears perk up and we get kind of excited. And, a lot of times patients go, oh, I didn't know that was relevant. You're like, yes, that's going to help me solve the case. So tell me what's happening. Oh, there we go. I got through that. I get these cramping pains in my abdomen, and then he points to or indicates the umbilical region. One of the things you want to be clear about when you're talking with patients, differentiate the stomach, just kind of on the right side a bit, and kind of upper right below the rib cage, and the abdomen, right? You've got, if you, we don't have time to do it right now, but if you go, you can find a chart and see where the abdomen is. Split up into 9 different regions. So it's good to be familiar with those different regions because they're referenced in the repertory. So anyway, he's indicating the abdomen is where his symptoms are. So when the cramps come, I get nauseated. So may have a connection there, right? The pain's there, the cramping's there, and then there's nausea with it. The pains happen on and off through the day. Sometimes my abdomen feels very weak and feels like something is going to push out here, and then he indicates the inguinal region. So there's a very good rubric that encapsulates this symptom right here. I've used it probably about 4 or 5 times over the years, and I'll get into why it's useful, but it is. I'm hungry all the time. Okay, appetite ravenous, appetite canine, appetite increased. Nothing really unique there, right? And even after I eat, I get even more hungry. So that's a bit unique, and we'll get into the rubric for that. So if they're hungry, do we have any food cravings or food aversions, right? Or things that aggravate or ameliorate? So are you desiring any particular foods or drinks since being symptomatic in the last 4 months? And he says fruits and coffee. Like it's a strong desire for coffee. So it's a big rubric. I think there's like 140 remedies in desire for coffee, somewhere in there. I also really want sour things like grapefruits and pickles. I want fruits like juicy grapes, oranges, pineapple, and pomegranate. So we have rubrics that we can think about for that. And so even though I'm eating all the time, I'm losing weight. I'm down 12 pounds in the last 4 months. And he's not a large person or obese. I would say got a normal build. Um, but he did look just a bit on the slim side. Um, so it was evident that he had lost some weight. And there's also some symptoms we'll talk about that I observed in his face as well. So any food aggravation or aversions, and he says he can't tolerate potatoes lately. They make me burp a lot and give me indigestion. And there's a particular remedy, and I'll get into the differential. But typically, when you think of potatoes aggravates, one of the main remedies you want to consider is alumina. Um, so let's we're gonna break down each one of these, right? So tell me about the rectal itching and pain. And he says, I feel the itching and the pain in the anus. And then you want to know about this. In the repertory, let me just show you. And let me just do a quick search for, so itching is huge, right? And itching is different. Oh, I don't want to put itching because there's going to be so many rubrics, but crawling and formication. So let me talk about this for a second because it's homeopathically relevant. We have a remedy called Formica rufa. Formica rufa, rufa means red and formica means ant. And the word formication means to crawl. So that's where the term formication comes from. It means like an insect or an ant crawling on you. And formication and crawling are very similar. There can be tingling, but formication and itching are not the same thing. Okay. Um, Let me just show you quickly. Um, the itching, we're going to have thousands of rubrics. Yeah, there's 3,000. So the anxiety with formication or from formication, anxiety with itching. Let me just go down. There's head formication. So again, it's crawling, like a feeling like an insect or an ant is crawling on them versus itching. And then we can go down into, can even just do this. So, and let's just look in the nose chapter as well, because he does have some itching in the nose. So there's 220 rubrics. There's epistaxis in relationship to itching, which is pretty unique. There's formication of the nose, 73 remedies. Inside at the dorsum, inside the nostril, and then nose itching. And you have location, um, constantly rubbing. That's actually a symptom. Constantly rubbing the nose can be an indication for worms. So nose itching from worms. There's 4 remedies there. Sina, Santinia. This remedy here is one of the chief chemical compounds in this plant, Sina maritima, Teucrium, and Spigelia. So anyway, and then there's also rectum crawling in. We click on that. It should take us to formication or itching. So you should ask the patient, is it itching or is it more like crawling? Okay. So he says itching, but sometimes more like crawling feeling. Sometimes my nose and hands get really itchy and crawly. So we've got the rectum, the nose, and the palms of the hands. It's where he has like this itching, crawling feeling. I get these sharp stabbing pains in my anus and they shoot down into my thighs. So this is a good rubric. And also with the extension or extending to the legs or the thighs, also makes it kind of unique. Anything make the crawling or pain worse? I definitely notice the pains more when I'm sitting for more than 30 minutes, and nothing seems to make the itching better or worse. And then I ask what part of your hands, because remember we have the dorsum, the back of the hand, the palms of the hands, the fingers around the thumb. So we need to be specific. What part of your hands and nose, the inside of the nose is where the itching and crawling is, and the palms of the hands as well. And then that happens several times a day. So you see there's some periodicity here, right? The abdominal symptoms kind of come and go. The itching and the different body parts, formication are kind of coming and going. So it's not really constant. And so then what was happening 4 to 5 months ago? I was down in Honduras from March to May 2017, working with an NGO. I was there for 12 weeks. I was involved with helping the people with infrastructure and projects in building a new school for the community. So you want to just hear more about it, right? Was there something emotional happen? Did something traumatic happen? Um, was it, something that he ate, some water that he drank? We don't really know yet. It was fulfilling work, but the people I worked with were very incompetent. I mean, I could have done their job better than they were doing. I probably could have done most of the work on my own. So we're getting here kind of an indication to his kind of his mental state and kind of how he thinks about people or what he thinks about people. So he could have done it on his own. I said, well, how so? Like, how could you have done their jobs better, right? Since I mean, I graduated with a bachelor's degree in nonprofit and NGO studies with a 3.7. I tend to be more efficient and competent than most people. Um, Anybody want to take a guess at some rubrics that might encapsulate this perspective on others? I'm sure I'll be a CEO of a large nonprofit one day soon, and then I'll put the other NGOs to shame. It won't be that difficult since there's so much incompetence and stupidity. So we could be dealing with haughty, we could be dealing with contemptuous, we could be dealing with, there's a particular delusion that we could apply to this paragraph here, or to his case. So think about a rubric that you might want to use to kind of encapsulate this. So then we go to the dizziness. He goes, I'm slightly dizzy most of the day. So that doesn't help too much, just like a low level dizziness. And I think he says here, typically it's like a 3 out of 10. But then it's hard to read or look up. So again, if there's a modality that makes the headache worse, the dizziness worse, the nausea worse, the itching worse, the joint pain worse, we want to know it takes it from what number to what number. So if he tries to read or look up, the dizziness will go to 7 to 8 from a 3. That's significant, so we want to use that. So what happens? I feel more dizzy. Oh, and also after going to the bathroom, I get waves of dizziness for about 5 to 10 minutes. And what he meant, BM, bowel movement, not urination. Because again, in the repertoire, we have to differentiate dizziness after urination or dizziness after stool. So anything make the dizziness better? So we kind of know what makes it worse. Closing my eyes. And that's kind of unique. And if I'm not mistaken, there's a Kunzli dot there. So we'd go to vertigo, closing the eyes, ameliorates. If I'm not mistaken. Yeah, there is a Kunzli dot. The reason this is unique is because typically when somebody has disequilibrium, they want to keep their eyes open to try to find an anchor point or try to get a semblance of being grounded and finding, spatial relationships, and usually keeping those helps them to not feel so dizzy. And in many cases, closing the eyes will aggravate. You see here, there's 40 remedies here for closing the eyes ameliorates. And then if we look at closing the eyes aggravates, there's still a Kunzli dot, but there's 85. There's more than twice as many remedies. So the fact that closing the eyes ameliorates is something we can use here. Anything else happen with the dizziness or anything else make the dizziness better or worse? And he goes, I get shaky. And I also notice my mouth starts watering, like when you're about to vomit, but I never throw up. So he gets dizzy, he gets shaky, and then and the mouth is watering as well. So we consider them concomitant symptoms, right? So we'll get into that as well. Then we did a review of systems. Everything else was unremarkable. I'm just putting in here what was remarkable in this case. He says, my gums have been bleeding very easily for the last 3 or 4 months. So that's pretty interesting. So eating something like an apple or brushing my teeth, and they'll bleed for a couple of minutes. So because it's only been a couple of months, that he's had this bleeding in the gums, we want to take it as part of the case. So the observation that I made was that his eyes appeared a bit sunken, and then we have bluish discoloration around the eyes. And we'll get into what that indicates, but you'll see some bluish discoloration around the eyes or under the eyes is something we typically see in pediatric cases. You've heard of allergic shiners. So when kids are eating something that they have some degree of sensitivity to, they can get like bluish rings under or around the eyes. So we've got a 34-year-old male, 4 months history of subacute GI symptoms, nervous symptoms, dermal symptoms, the itching, and that's all consistent with helminthiasis, which is a type of worm infection. So you order a, it's ONP, not GNO, ONP, ova parasite ×3. So what they do is you take stool samples, and you can do it every day or every other day. In this case, we did 3 samples, 1 sample per day. And then you send it off to the lab. So 6 days later, after the consultation, we ordered the labs, and they indicated a tapeworm. And the way they'll know that it's tapeworm is they'll find ova, and then they can also find little pieces of the tapeworm, the tail or the head, or just different segments of it, because they can break off and end up in the stool. So he was given his remedy and a 6C, and I just started with the 6C because of the physical nature of the case, right? There's not a lot here. It's not like his dreams are being disturbed, or it's behavioral, or he's got these rages or anything like that. This is mostly physical, so I figured that a lower potency would be the most effective. So 2 pellets once a day, and then follow up 5 weeks after the initial consultation. So it's 4 weeks. I didn't give the remedy. Let me see, I should have put it in here. I didn't give the remedy at the consultation. We did got the results back from the OMP ×3 first, and then we started the remedy. So 10, 25, 17, my symptoms are much better. 5 days after starting the remedy, he said he pooped out a large tapeworm. So this also indicates something about the germ theory versus the terrain theory, right? The allopathic system is set up on, if there's a virus, you got to give an antiviral. You got to attack the virus. If it's bacterial, you got to kill the bacteria. If it's a worm or a parasite, you got to attack those. And if that were truly the case, homeopathy wouldn't work for infectious disease. I've got a case on my Odyssey channel of a MRSA case, right? Where there was clear lab result that the patient had this ulcer that was not healing, and they swabbed it, and it came back positive for MRSA, and it gave a remedy, and within 5 weeks it was almost completely healed, and no antibiotics were taken at all. So just keep that in mind if you haven't already thought about, how does homeopathy treat illness that is typically associated with an organism, right? And the reality is the terrain or the system, because of the derangement of the vital force, the physiology is set up to allow, in this case, the worm to be there and to propagate, to allow the bacteria to be there and to infect the system, to allow the fungus to be there in the case of thrush or candida. So you don't necessarily have to direct any particular therapy to something in the system that's been detected by some lab. Find the totality of the case, give the remedy. If the remedy normalizes the physiology and the function of the body, it will dispel or discard whatever shouldn't be there. And in this case was the tapeworm. So my dizziness is reduced 90 to 95%. My abdominal pain is down significantly. My appetite is back to normal, and I've gained back 8 pounds. Sharp anal pains that shoot into the thighs, that hasn't happened in weeks. I can sit now without the sharp pains. How about the itching, formication in your nose, anus, and the palms of the hands? Essentially, all those symptoms are gone. Um, Itching of the skin um, can be an indication that the liver is inflamed or being affected by what's going on by the body. You can also see that with the palms of the hands. And also the anus, you have to think about pinworms as well. Um, Bleeding of the gums, that's not happening. Weak feeling in the inguinal region. We'll get into that rubric. That's much better. That sensation, right? Um, Desire for coffee and fruits and sour pickled foods. He's not craving those anymore. Um, and then the observation I made was that his face had filled out and the blue rings around the eyes had also gotten better, resolved. So she's doing much better. There's no reason to continue the remedy unless symptoms come back. We ordered another O&P times 3, which came back normal. And I wanted to follow up with him after one more month. And so the O&P, we got that back shortly after the second visit on the 25th, about a week. Um, that came back normal. So there's, again, no reason to continue taking the remedy. Um, and then our visit was pretty short and concise. Patient reports feeling normal, no GI symptoms, vertigo or dermal or rectal symptoms in the last 4 weeks. And he made a complete recovery. So that's the case, abbreviated. Let's see. Give me one second. I want to go to the analysis. Anybody here or want to offer up any thoughts on there's the PowerPoint slide, which I don't want. Here we go. There we go. So case analysis. Anybody want to, anything in the case that they really thought should be repertorized? Anybody want to chime in? If not, I'll just start going through the case analysis that I did. Um, I'll just start, and if you want to add anything, please do. You can type it into the chat. So sensations, experience, mental, emotional. So the people I work with were very incompetent. Probably could have done most of the work on my own. I could have done their job better than they were doing. I'll put other NGOs to shame. I'm more efficient and competent than most people. Others are there's so much others so much incompetence and stupidity. Um, so the rubrics you want to consider for that are obviously in the mind chapter. So mind, um, contemptuous is one rubric that comes to mind. And we see her despising, not appreciating others, scoffing, scorning, sneering at everyone, condescending attitude. So I think we could see that here in this case. He does a better job. He's more efficient. Everybody's stupid. The other might be mind censorious, right? We'll go there. Exact fault finding in others, fussy, difficult to be reassured, critical. He's critical, right? I'm not sure if I would say fussy or exacting, but he is critical. So we can put that in there. If he feels like he's better than others, we want to go to mind, haughty. So imperious, overbearing, overweening, pride, proud, arrogance. So we can add that in there as well. And then the one delusion that we can add, mind, delusion. He is a great person. Right, so we got 62 remedies in there. And you can see sub-rubrics here. He himself to be Christ. We obviously don't see that. We don't see that in this case. Sensation as if he could do great deeds. Dictatorial love of power. We have haughty. Sensation of power. Desires to be respected. But we can definitely put this here in this rubric here. All right. So I think that was it for mind. The dizziness, we had some really interesting symptoms here. So slightly dizzy most of the day. That I did not repertorize. Worse reading and worse looking up. So that's under vertigo, reading. So aggravates. So I just grab this rubric and also vertigo. Looking is really important. You can see dizziness when looking back, when focused or concentrated, which is looking steadily, looking straight ahead, looking at revolving objects. The main remedy for that is lycopodium. You can see there with a Kunzli dot. This is actually, I found this rubric to be very helpful as well. Dizziness or vertigo when looking at moving objects. So this is when somebody's standing on the street and a car goes by, if they try to watch the car and they get dizzy. Or if they're in a car and they try to look at things passing by and they get dizzy. This is when you could use that. Looking at moving objects causes dizziness. The movies. So upward, looking upward aggravates. So we'll take that rubric and put that in the clipboard. Oh, after stool. That was a good one too. Vertigo, stool, after, aggravates. So I put that one in there. Better closing the eyes, and then the concomitants, the shaking and the salivation. So just backspace, vertigo, closing the eyes, ameliorate. There it is here. And we'll just pull this one over. And then, so if you want to find where dizziness is associated, it will be under accompanied by. So shakiness is going to be trembling. So we take this and we pull this in. This is a good rubric, a good concomitant. I don't hear this very often. So they get dizzy, they get kind of shaky. The dizziness goes away, the shakiness goes away. They have to be connected. And then salivation. Put that in there. So then we get to the stomach. Okay. So the cramping in the abdomen and the umbilical region. You're going to find a lot of, if you don't know exactly where you would look for that, you would go here. This is just part of our exercise, learning the repertory. So I'm in the search function and I'm in the advanced search. Let me just close this out quickly. So these are all the tabs that I can open up. I can jump around. Here's the Materia Medica tab. Here's the repertory tab. Here's remedies. You know, if I click on this here, this little caret pointing downward, triangle. These are all the remedies that I have open right now. Okay. So if I want to, if the search window's not open, I just go to search here. If I click on this, the simple search will come up where you can just search one term at a time. I never use that. I always use the advanced search. So advanced search is right under this little triangle, a little caret facing down, downward pointing caret. When I go to advanced search, and then that'll open up this window here. We have 4 options. So if we type in cramping, umbilicus, and obviously we're in the abdomen chapter. So we want to find cramping in the umbilicus in the abdomen chapter. We want to look at all repertories, even though I'm going to use Adonis. So abdomen pain, umbilicus cramping, above, below, in the region. That's actually the one I used. Cramping. There was no time modality, so not afternoon, evening, night, bending. There, abdomen pain, umbilicus, region of cramping. That was the one that I used. So we can just grab this and pull it there. When the cramping comes, I get nauseated. So nausea. pain. So if we look up nausea, pain in the abdomen, and we look in abdomen, I don't think anything will come up because nausea is under the stomach chapter. So we can either get rid of abdomen and see what comes up, or we can type in stomach. I'm going to just get rid of it and see. There should be a rubric for nausea with abdominal pain. What we're looking. Stomach nausea from pain in the abdomen. So we can double click on that. Click on that, and you've got 69 remedies in here. Colocynthis and nux are big, obviously, but you've got all these other smaller remedies. Antimonium tartaricum, which we wouldn't really think of, and fentanyl, which we might. So I use this rubric here. I feel very weak. Feels very weak and feels like something is going to push out here in the inguinal region. So this is the rubric I was telling you that I find very helpful when it's appeared in a handful of cases over the years. So it's abdomen, pain, it's in the inguinal region. You know what? Let's use the search function. So, inguinal region, as if there was something going to protrude is the term we're looking for. It's not a hernia. Pain in the inguinal region, not in the morning. Abdomen pain, inguinal region, as if hernia would protrude. That's the one we're looking for. Because when they say it feels like something's going to come out, that's what a hernia is. It's when a loop of intestine pushes out and pushes through. So when somebody says, I feel like there's a weakness there and it feels like something's going to pop out, not something's going to snap or break or something like that, but something's going to push through or pop out, or it feels like something's going to protrude, then you can use this rubric. So I use that rubric for his case. Feels like something's going to push out here, and he pointed there. I'm hungry all the time, and even after hungry, I get even more hungry. So what we're going to do is we're going to look up appetite after eating. And that's obviously going to be in the stomach chapter. So we'll just put the stomach to keep the search relevant. So this 19, appetite increased forenoon after eating. Again, we don't have a time modality here. Stomach appetite increased after eating. So that's a pretty big size rubric, 117. Ravenous after eating. And there's a bit of subjectivity here. Like, is the appetite increased or is it ravenous? Or even call it canine. So we can do is we can combine those rubrics. Ravenous is definitely not wanting. So let's appetite increased, appetite ravenous. We'll group those together. Combine. And let's see. We go back to what we were doing. I'm eating all the time and I'm losing weight. So we're going to go to appetite with emaciation. Technically he's not emaciated right now with 12 pounds of weight loss, but if he went another 6 months without being treated effectively, he probably would start to get emaciated. But if you have somebody that's very hungry and they're eating all the time, but they're losing weight, this is the rubric you would use. And so if you go to appetite ravenous accompanied by emaciation, it'll take you to generals. Generals emaciation with ravenous appetite. So we can go here. And what's interesting is the remedy is not here, but in Murphy it is. So clinical appetite ravenous with emaciation. So we can combine those as well. We'll do it right now, but we can't. So down 12 pounds in the last 4 months, and then fruit, coffee, sour things. So fruit, the different rubrics we can use. So when I clicked on Murphy over here, it brought me to this, my open active repertory window is now Murphy. So if I want to go back to Adonis, I press the downward arrow here. These are all the repertories I have open right now. So I go back to Adonis and I just click on that, and then it takes me back. If I want to go back to Murphy, I can go to Boriki, and then there's Murphy if I want, but I'm going to stick with Adonis. So then the food, that's going to all be under generals, food and drink, fruit, desires. Also, it was juicy fruits. So we could put that in there, but juicy fruits, desire for fruit, desire. And we can also put juicy things and sour things, sour foods. There's a rubric for juicy things, desires, and then coffee, which is going to be big. So it's 191 remedies of a strong desire for coffee. So this is more of a confirmatory symptom, not necessarily a symptom that's going to make or break your case. So if the remedy's not in there, don't worry about it too much. And then sour things, sour foods and acid desires, 211, huge. So we can put that in there. Then what else do we have? Really want sour things like grapefruits and pickles. I want fruits, juicy grapes, oranges. We have fruit, potato. So there's 2 rubrics that I used in this particular case. If you went here to potatoes, aggravates, I think that's good enough. But there was also stomach irritations from potatoes, aggravates. Put that in there. Yeah, potatoes, they make me burp a lot, give me indigestion. So we go to the rectum symptoms. So it's more like a crawling feeling. So that's formication, right? We talked about that. So rectum, formication, it should be in the anus. Put that in there. And pains that shoot down into the thighs. So pain extending to thighs. That there. And pain worsens sitting. Sitting aggravates. Sorry, pain. Sitting aggravates. Can use that one. So we have a couple more. Hands, palms get really itchy. It's a good symptom. So that's under extremities, not external throat, extremities. Itching, hands, the palms of the hands. So we can put that in there. and gums, bleeding easily, and then the bluish in the nose itching. Let's do the nose. Nose itching inside. We can even put formication, which is crawling. Formication. Crawling in the nose. The gums, so mouth, hemorrhage, the gums, easily. Put that in there. And so that eyes appears sunken and bluish under around the eyes. There's two separate rubrics, face, sunken, but actually in Boriki, I believe it's Boriki. And then face, discoloration, blue, eyes. I usually use around or under the eyes. You can use both of those. So around, eyes, under as well. But if we go to, I want to search Boriki. Bluish, sunken. And it's either, there it is, Boriki. Eyes look conditioned, sunken, surrounded by blue rings. So this is very descriptive. It's a very good rubric. This is why I like to look at, as you can see, when we're jumping around to the different repertories, you're seeing little variations where some rubrics will have remedies and some rubrics won't. Some repertories won't. So it's a good idea to find I'd say, Adonis, and then find 2 or 3 other repertoires you really like to go back to and reference and combine rubrics. So for me, it would be, I would say Adonis, Murphy, and Borky, and also Boger. I use those quite a bit, and Nur I use quite a bit as well. So we've got that, and then I just wanted to say here, so Illumina has the aggravation from potatoes as far as DDX goes. With regard to the vertigo, you want to differentiate this remedy from phosphorus and cuprum and natmur. And as far as tapeworms go, calcarb, Felix mass, which is a fern. It's a big remedy for worms. Carboveg is a big remedy as well, and so is sabadilla. But calcarb is actually the main remedy. So we go, let me just show you quickly. Go to Adonis, and we go to rectum, worms, complaints of, and then tapeworms. Calcarb is a grade 3. You've got all your other remedies here, 83 other remedies, but calcarb is the main one. All right. So we've covered the analysis. And so the remedy we're looking at is homeopathic granatum. And you say, well, what is granatum? Is that granite? No, it's not. Granatum is pomegranate. And one of the foods that he actually had a craving for was pomegranate. So we see it covers here contemptuous. It's actually under censorious, haughty, delusions. He's a great person. So we see that it covers the mental symptoms of the case, as the dizziness with the aggravation from reading and looking up and after stool. After stool is the smallest one, and it covers that. Closing the eyes ameliorates. It covers the concomitants of trembling and salivation during the dizziness. And we see here abdomen pain, the umbilical region cramping. Again, big rubric, not very specific, but it's good to see it in there. It's also covering, this is a good rubric here, the nausea during abdominal pain. And this one here, this is the one that I pointed out earlier. Pain in the inguinal region as if a hernia would protrude. So it's not that they have a hernia, it feels like something's going to protrude, a loop of intestine is going to push out, which is by definition a hernia. Appetite increased after eating, it covers that. So you see here, down here, emaciation, under generals in the Adonis, emaciation, appetite with ravenous, it's granatum is not there. But under Murphy, appetite generals, ravenous, appetite canine with emaciation, it is there. We've got the desires for juicy fruit, it's not there, but desires for fruit, desires for juicy things, desires coffee, desires sour food and acid food like vinegar, things like that. Aggravation from potatoes. Then you've got the crawling, the pain in the rectum extending to the thighs. The pain in the rectum is worse from sitting for prolonged. For him, it was more than 30 minutes. Then you get these really sharp pains. Then it covers the itching, the gums that bleed easily. And then when we look here in Boriki, the sunken eyes surrounded by blue rings. We've got arsenicum, camphor, china, nat carb, and there's granatum. Let me just go back one second. I wanted to touch on one thing. It'll come back to me. So if you just look at the repertorization, you've got granatum number 1, phosphorus, which you'd have to do DDX on. Sulfur is always going to pop up in your top 5 remedies, I'd say 90% of the time. Calcarb is there, natmir is there. Let me go to the PowerPoint presentation that I had. Yeah. So granatum, homeopathic pomegranate. And just so you know, in homeopathy, we've got lots of different remedies from foods. We've got pomegranate, we've got chocolate, we've got milk, we've got skim milk, we've got cinnamon, we've got strawberry, right? There's a lot of different foods that we have, banana, musa. So there's a lot of different foods that we would not necessarily consider remedies in the materia medica that are there. So under Clark, Dictionary of Practical Materia Medica, the homeopathic proving brings out many symptoms of helminthiasis as pale blue rings around the eye. So these are all indications that somebody has worms, okay? And these were, when they did the proving, these symptoms came up in the proving. So then they thought, hey, people have worms, they kind of present like this with these symptoms. We did this proving on this fruit, and it has these very similar symptoms. So let's look further into this. Pale blue rings around the eyes, or around the eyes, itching and crawling, tickling of the nose. Again, that's a pretty big, anytime you have a child that's constantly rubbing the nose like this, and or if they have rectal itching or abdominal symptoms, you might want to consider remedies for worms. You might want to consider doing, if you can order them or send them to their primary care to have their stool checked for ova parasites. Ravenous hunger, craving for sour or juicy things, fruit, coffee. This was all from Clark's Practical Materia Medica. Loss of appetite. In his case, he had a very strong appetite. Nausea, fermenting in the abdomen, ripping, dragging in the inguinal region as if a hernia would protrude. So there it is, coming straight out of the proving of the remedy. Itching and tickling in the anus frequently during the day. Emaciation, he had that. Didn't have convulsive movements. And then we go to Boriki, Pocket Manual of Homeopathic Materia Medica. As a vermifuge is something that just expels or pushes out worms for the expulsion of tapeworms, and homeopathically for the following symptoms indicated. Saliva with nausea and vertigo. He had the nausea with the abdominal pain, but not necessarily nausea with the vertigo, but he did have the salivation. Sunken eyes, pupils dilated, did not have that. Weak sight, did not have that, but he did have the sunken eyes. Vertigo, very persistent. So again, if we're going to think about worms and we want to think about, well, what key symptoms might we want to think about? Dizziness would be one of them. and constant hunger, which he had, poor digestion, loss of flesh, and itching of the palms. So those are some keynotes. And what I'm going to do, let me just go here, and I'll just pull up with the search function. And again, if you type in a remedy here, just type in, I don't know how many. I'll go back to Granatum in a second. You go to all documents. This is kind of my go-to because he has most of the, he'll give you what the remedy is, whether it's plant, mineral, animal, gives you is Clark, not the repertory, Materia Medica. Clark's dictionary, this one right here. He always, potassium chlorate, he gives you the chemical breakdown, titration, then gives you clinical indications. So same thing with granatum, pomegranate. We search all documents. You can see the remedy's been used for quite a while, and it's got extensive or solid materia medica. It's not overly indicated, but it's also there's quite a bit of information, quite a few symptoms that we know about this remedy. So it's not a very small, I would say small remedy. If we go here to Clark, Bonica, granatum, pomegranate, and this is the family it's in. Homeopathic tincture tells you they make it from the trituration of the bark of the root. And then this is actually, I think, a remedy as well. Then he gives you the clinical indications, worms, gastralgias, umbilical or inguinal hernias. So it does also treat hernias, leukorrhea, tapeworm, toothache. So it's a well-known vermifuge, especially used for the expulsion of teiinae, which are tapeworms. The other thing that just came to my mind that I wanted to share before we finish up, so there's the sharp pains that we covered week 1. So it's under rectum pain, anus, proctalgia fugax. Again, really sharp pains, and you will see there's granatum is there, and Farouk Master has put that in there. He's put all of these in here. So anyway, I enjoyed this case. It taught me a lot about the power of the vital force and how if you just give the right remedy and get the vital force on track, the vital force will normalize the physiology in turn, the immune system will expel whatever's there. You don't have to go to war with tapeworm, fungus. I mean, I think that's one of the biggest things that we're struggling with as collectively as humanity is, constantly feeling like this thing can invade me, this thing can infect me, this thing can kill me. I've got patients that are constantly battling these viral infections. All right, well, let's figure out what's going on with your physiology as to why you're getting sick so frequently. And is it the virus? Because not everybody gets viral infections twice a month, right? Not every, you can get 100 people that eat the same food and 3 of them get food poisoning. So the state of the vital force is extremely important. And again, we don't need to go to war with any disease. It's, the paradigm that we function from is one where we see the illness, we see the dysfunction, and then we try to find what's in the materia medica through the repertorization to normalize the physiology, normalize the flow of the vital force, and it will take care of whatever's going on. So we don't have to go to battle or go to war. Okay. Well, I think that's it. We're almost at an hour. So, wow, we went from 4 to 12 people. You're very welcome. Yeah. I hope you enjoyed the case. I think these cases are being posted on Radar Opus. So if you missed it or you came in late, you can find the reposts. Okay, so thank you very much. I think I'm done now for this series of 3. I'll talk to whoever I need to talk to see if we can do like another series if people are interested. I like doing these cases because when you teach cured cases, it gives you practice in uh, the case, not necessarily case taking, but case analysis, and the practice of going from the symptom to the repertory, and then you start to learn a remedy in context instead of just reading materia medica amorphously, not attached to a case. So anyway, that's probably how I will continue teaching. So I'll see if I can get another group of cases together to teach using Radar Opus. So thank you all, and thank you for attending, and have a great morning, afternoon, evening, or night, wherever you are. Okay, thank you.